It's precisely because we don't know enough about this variant that we've taken the action that we have. So our strategy is all about buying time so that we can assess it, but also that we can build our defences. And we've been really clear in the last few days, I think, that the best way to continue to defend ourselves is through our fantastic vaccine programme, and that's exactly why we're expanding the booster programme. There are 32 confirmed cases at the moment throughout the UK. 22 of those are in England and 10 are in Scotland. As I've said recently, we do expect cases to go up, and we are working hard in terms of testing and target testing and sequencing of those tests to do that. I think we're all together across the world learning more about this variant, so the work that the World Health Organization does is going to be important, but equally what we do. I hosted a call of my G7 counterparts just yesterday to talk with them and listen to them about the work they're doing. So we'll all work together, and I think in doing so we can collectively learn much more about this variant. What today's Adult Social Care White Paper is about is setting out a 10-year vision for world-beating adult social care reform with control and choice and support at its heart. It includes some £5.4 billion of fresh new funding over the next 3 years to support things like more investment in the workforce, so there's more training and there's more development. It supports transforming homes so that people can live in their own homes for longer, and things like digitisation, not just digital patient records, which will help a lot, but even things like helping people, vulnerable people, with sleep so that they can have an uninterrupted sleep, which really, really helps. There is a short-term challenge with staffing levels, and we've been really open about that. We're working with the sector to have the largest recruitment campaign they have ever seen. Also, we provided just a couple of weeks ago additional funding, I think of £162.5 million through local authorities to care providers, and that's certainly helping. And on top of that, the NHS recently is using some £500 million of funding to help with deferred discharges. So these are people in hospital that are clinically ready to be discharged, but the care packages that they need, whether in their own homes or in a care home, aren't there, and that's helping and making a real difference.